Tactical Blue TV, the place where badass sheepdogs read, listen, and watch unique leaders who teach the science of law enforcement, tactics, and practical skills to coach the American cop. If you're a badass, this is your new home. Now, the man who catches speeders during his lunch hour, Hector Solis.
A law enforcement guide to COVID-19 Part 2. In Part 1, I wrote about the COVID-19 symptoms, preventive measures, and how the virus is spreading. Additionally, I explained the risk levels presented to law enforcement and correction professionals. COVID-19 cases are growing by the day. You might think this is a problem for large metro areas, and the virus isn't going to affect small-town policing. I can guarantee you will see a COVID-19 case in almost every type of jurisdiction. America's countryside isn't safe. One very possible scenario will be the following. A person who lives in a large metro area isn't working at this time because of the state's mandate. This person decides to take his workload on the road. Plus, he or she decides to visit her parents or his parents who live in a small town. This person is asymptomatic, meaning the virus isn't showing any symptoms of COVID-19. Who knows? This person even tested negative 2 weeks ago. But now they were in contact with an infected person while buying groceries. Finally, this person arrives at his or her parents' home. They have a nice dinner, enjoy their evening together. The next day, the mother of this person attends their prayer group with less than 5 people in it. The sequence already started. There's no way to stop it. The virus found a new host, the mother, and is incubating in her lungs. As she speaks with other members of the prayer group, she is transmitting the virus to others. Your community now is infected, and the daily activities became a weapon against rural America. Your small hospital is overwhelmed with cases and no supplies. Your emergency medical services and volunteer fire department might not have the resources either. Now, the virus might be inside of you right now. Unfortunately, law enforcement and corrections officers are at the medium risk level of contracting COVID-19. Medium exposure risk jobs include those that require frequent close contact with people who might be infected but not know. If you suspect you contracted the virus, act fast and self-monitor your symptoms. You could fall in the asymptomatic category. You should self-monitor. Self-monitor is an effort made by you to determine your current state of health or illness. Police and correctional officers should monitor themselves for a fever by taking their temperature twice a day and remain alert for a cough or difficulty breathing. During the self-monitoring period, you should self-isolate, limit contact with others, and seek advice by telephone from a healthcare provider or your local healthcare department to determine whether a medical evaluation is needed, including the new tests for COVID-19. Now, how long should you self-monitor? Based on the current information of coronavirus, it has an incubation period of around 14 days. Employees who have a possible exposure should self-monitor for at least 14 days. Now, what is the correct temperature? Any temperature at or above 100 degrees should be considered a fever. Consult with a healthcare provider to see if it requires further action. So you perform self-isolation, you might ask yourself. Self-isolation means staying indoors, avoiding contact with other people, including family members. Try to stay no closer than 2 steps or about 3 meters from others. Self-monitor and wash your hands often. Wear a mask as required if you must go in public, for example, to a medical facility. Disinfect surfaces as much as possible using cleaning and disinfecting wipes. You could also self-quarantine. Self-quarantine is avoiding contact with others, including your family, and social situations as much as possible. So not going to the doctor, not going to the store, nothing. A doctor might ask you to self-quarantine because you have been in close contact with a case of coronavirus while you're still well. The reason is to stop other people from getting it if you develop any symptoms. Now, as a supervisor, you have the duty to act. You must have an action plan. If one of your employees develops a fever or other symptoms, coughs, shortness of breath, etc., they should contact you to inform you of their status. Contact the law enforcement agency's healthcare provider and follow their directions. Also, you could follow the CDC or OSHA advice of self-isolation and self-quarantine, as stated above. Discuss your action plan among other supervisors and your troops. Emphasize the new directives is not to cause any panic, but to prevent the spread of an unknown virus. You will get the not-all officer who might reject the new ideas. However, just like a virus, you must prevent negativity from spreading among other law enforcement professionals. I discussed the following information with my partners, and I provided a training session to them. First, cough etiquette and flu precautions. Cover your mouth and nose with a tissue when you're coughing or sneezing. Avoid touching your eyes, nose, and mouth. Wash your hands as often as possible with soap and water. Remember, at least 20 seconds. Or, if it's not possible at the time, use an alcohol-based hand rub, especially after coughing or sneezing and before eating. Discuss the transmission and prevention of COVID-19. Also discuss self-monitoring and provide any literature. Follow the public health mandates and advise workers on where to locate information. Some of the symptoms that you must look with staff are fever or chills. Older adults might not have a fever. Cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, and vomiting, or diarrhea, more common in children. As police officers, we come in contact with all types of people. Some of them might not have the best hygiene. Police equipment and patrol vehicles should be cleaned daily, according to your SOP. Therefore, this time it should be actually mandatory. I asked my partners to perform the following. They need to conduct hard cleaning of any surface. All hard surfaces areas should be cleaned daily at the beginning and end of the shift, or before and after use, depending on the situation. These areas should be cleaned with a disinfectant solution or disinfectant wipes, like Clorox wipes, Lysol, etc. They're supposed to clean all the MDCs, ticket writers, printers, keyboards and mouse, any cell phone, whether it's a landline or an actual cell phone, printers, radios, chairs, and all the interior of the patrol vehicle. I know it's hard to find brand and off-brand disinfectant products right now from traditional retailers. In the meantime, while the department finds a vendor, make a disinfectant bleach solution. The solution is a 1 in 10 solution. The easy way is 1 cup of bleach for 2 cups of water. Personal protection equipment, as also known as PPE, is a must to combat the spread of COVID-19. Supplies for this equipment is low right now due to the federal and state governments purchasing them in large quantities. If you find a vendor with any inventory left, don't hesitate and purchase as many as you can afford. Ideally, each officer should have at least 2 PPEs. However, if the law enforcement agency could equip each patrol vehicle with 1, that is kind of like, the best case scenario, depending on the situation. There are some alternatives to PPEs. Unfortunately, in our case, we were behind the curve and didn't acquire any PPEs before the storm began. I spoke with one of our reserve police officers, Jason Payne, about the shortage of supplies. Fortunately, he is an OSHA certified instructor and former military. Together, we came up with a plan to purchase items from local retailers, like Home Depot and Lowe's. These items combined could create a PPE that is very close to the ones purchased from specialized vendors. The Center of Disease Control and Prevention, CDC, recommends in their law enforcement guidelines, PDF, certain fundamental items in their PPE. The minimum PPE recommendation is a single pair of disposable examination gloves, disposable isolation gown, or single-use disposable coveralls. Any approved particular respirator as N95 or higher, any face masks that are acceptable alternative until the supply chain is restored. Eye protection, goggles, or disposable face shield that thoroughly covers the face and sides of the face. If unable to wear a disposable gown or coveralls because of limitations with your duty belt and gear, ensure the duty belt and gear is disinfected, each single item, after contact with any individual. Officer Payne recommended we double up with the gloves and the boots. I went to both retailers mentioned above and I found the items. First, I checked the local law enforcement vendors for PPEs. Unfortunately, larger law enforcement agencies already order supplies, leaving smaller agencies to be more creative. After speaking with Officer Payne, he advised I should visit the Home Depot and Lowe's. I drove to both locations and put together an alternative PPE. The first one was a DuPont Tyvek XL painter coveralls with hood and boots. Tyvek is a brand flash spoon high-density polyethylene fiber, a synthetic material. The coverall with the hood and the boots protects the police officers from any bodily fluids. The coverall is one-time use. Make sure you purchase enough for at least 2 COVID-19 contacts. Although the coveralls already include boots, Officer Payne recommended adding a secondary boot cover. The HDX shoe guards are durable, made of 3-layer construction which resists tearing and also helps protect your shoes. Plus, those are elastic which ensure a snug fit around your ankles. The label states they are washable, but because of COVID-19 is highly contagious, I recommend disposing them after usage. The first layer of disposable gloves is the standard patrol gloves we use all the time. The disposable nitrile gloves should be pulled over the end of the sleeve to seal the coveralls. Next, you can add the second layer of gloves. I recommend the Grease Monkey latex gloves. Place those gloves over the first layer and pull them as high as you can. You will ensure that you are covering all the way to your forearm for maximum safety. Any goggles are good, especially goggles that cover the majority of the area around the eyes. Also, the goggles need to be fit and tight to avoid airflow. The HDX safety goggles work really well. Next, and the most important, we have the 3M disposable N100 mask. Fitted with 3M Cool Flow exhalation bulb. This respirator is ideally suited for work situations involving heat, humidity, or long periods of wear. Officer can comfortably work with this mask. The air flows in and out, avoiding the stuffed air sensation many other masks have. Same as the rest of the PPE, this is only for one-time use. You should dispose them once you use them. If you go to my site, www.tacticalbluetv.com, you can read part number 2 of this guide and also how to perform donning and doffing of your PPE. That means putting it on and putting it off. And there's a specific way and a specific steps that you have to follow for maximum safety. Now, when to use your PPE as a law enforcement professional. Police officers who engage in the following should use their personal protective equipment. Any call responding to a deceased person, regardless of the circumstances. Unfortunately, with the COVID-19, people who already, they passed away, they still can produce, the virus through their nose, and you can still get contaminated, even if they pass away. For corrections, anytime an inmate shows symptoms or is positive for COVID-19, and for any calls to assist EMS, I know you might say, well, they can go first and I go second and I don't have to deal with it. But sometimes you might need, to help them out, if lift people or something like that. If they test positive for COVID-19 or show symptoms, definitely wear it. Additionally, our chief of police requested the officers to use disposable gloves for any type of call they respond to. Here in Central Texas, we currently have over 60 confirmed cases of COVID-19. So it can be spread around, and he's trying to prevent, us getting sick. Now, there are some safety considerations. As police officers, we must take all precautions for our safety. If you respond to a call where the PPE is required, consider the following factors. Number 1, PPEs do not work over tactical vests or duty belts. So I guess you will have to clear and secure the scene before you put it on for yourself and other emergency medical personnel. Have a backup. Officers fully geared up just in case, things go south. If possible, bring an alternative holster. Outer or inner belt work really well. So you can use it with your PPE just in case. I don't want that you go inside a house if you're not armed. Work boots could rupture the PPE covers. Like when you're walking, depending on the surface, etc., that can happen. At no point you should place your safety above the medical call. If you feel the use of the PPE could place you or other people at risk, like I said, not wearing your law enforcement equipment, then advise your supervisor about the circumstances. Remember, use common sense. Every service call is different. The final checklist before I'll let you go for today is, if possible, maintain a distance of at least 6 feet while performing civilian interactions. Practice proper hand hygiene. Wash your hands with soap, water, and for at least 20 seconds. If soap and water is not available, remember, use an hand sanitizer with at least 60% of alcohol. Do not touch your face with unwashed hands. Have a trained medical service or EMT access and transport anyone who might be positive for COVID-19 to a healthcare facility, including inmates that you already arrested. Ensure only trained personnel wearing appropriate PPEs have contact with individuals who have or might have COVID-19. Learn your employer's plan for exposure control and participate in all hands-on training for the use of the PPE for respiratory protection, if available. If you get in close contact during an apprehension, clean and disinfect your duty belt and gear before reuse. Any household cleaning spray or wipe according to the product label, use it. Make sure that it doesn't affect your equipment. Follow standard operation procedures for the containment and disposal of used PPEs. And also make sure you follow the procedures for containing and laundering clothes. Avoid shaking your clothes. When you get home, you don't want to spread that stuff to your family. So definitely, if you could, go to the backyard or in the garage, take your stuff off. Make sure you spray it with Lysol or some type of product disinfectant. And that way, take a shower right away and make sure you don't spread that stuff around your house. And I want to thank you for taking the time to listen to me. If you want to learn more, go to tacticalbluetv.com. I have all kinds of information for the COVID-19 and other stuff for training for police officers and correctional officers. So thank you very much. Please stay safe out there. We're going through some rough times, here in the United States, but we can do it if we work together. Stay safe and watch your six.
Thank you for joining us on another episode of Tactical Blue. If you know other sheepdogs, share this episode.